Hi, I'm Dr. Garris with TMJ and Sleep Therapy Center of Utah, and we are here with TMJ Unlocked, and I'm here with a great friend of mine.
Oh, I'm Tyler Cheatwood, owner of TLC Massage Therapy, and I'm here with my teaching assistant, Shelly, the educational Skelly.
And we're here to talk about how massage therapy plays such an important role in total wellness and how it fits into our treatment of TMJ and sleep apnea. I just recently watched a Facebook ad that pops up. I get all these Facebook ads about sleep, popping up. And I got this Facebook ad. What was really interesting is it talks about snoring and how we can, it's an ad. So, how we solve snoring through this ad, how this woman's able to do that. But it says that snoring and nighttime breathing has nothing to do with your upper airway. I know. And I watch it over and over. And it repeatedly says nothing to do with your upper airway, nothing to do with your upper airway. It all has to do with your throat.
Car accidents have nothing to do with people driving.
I know. So we go back and we look at this. And I'm like, really? Because upper airway has so much to do, and that's why we have shifted in our treatment of sleep apnea. We no longer call it necessarily sleep apnea, but sleep disorder breathing, because it involves so much more than just the throat area. It involves the upper airway. So I just thought that was kind of interesting and tie that in with our other patient. I watch these things and just think, what are we doing? We need to be treating sleep a lot more and relaxing and getting that anxiety and that stress removed so that we can actually sleep. And sometimes breaking that cycle requires going to a massage therapist. It requires getting some of that relaxation, that tension all broken up in you, so you can actually sleep a lot better because you've gotten caught in that cycle. What do we have to do now to break you out of that cycle?
Right.
And just getting to sleep well is going to be really tough if you've got that tension and that anxiety and stress and everything that's just compounded and growing. So tell me a little bit more about where massage therapy comes in. It's incredibly healthy because it's not just about relaxation. It's not just about getting your muscles all massaged, but it's about resetting the system. So tell us a little bit more about how what you do resets that system.
Yeah. So massage therapy, obviously it's a touch therapy. If you haven't received massage therapy in your life, the objective of massage therapy is, again, using my hands. I work through skin, fascia, fat, fascia, down to pressure on the bones, right? Getting everything moved, getting everything relaxed, and getting it moving more the way that it should move. It also helps facilitate good blood flow through the system. Obviously, we're not interacting directly with the cardiovascular system. I'm not moving blood, but because you work the tissue, just like when I work the muscles by moving my own hand, blood runs into those muscles because I'm asking for the blood by moving them. One of the things that massage does, and people are very familiar with it in a psychological state, is that touch, simple touch, boosts oxytocin, a relaxation hormone in the body. Oxytocin is, they call it like the bonding hormone. It's the hormone that's released when, a parent holds their child or when you get a hug from that loved one. You can have that same effect with massage therapy because you're in a space where there's no chaos going on. There's no moderate discomfort sometimes, but not pain going on. There's no danger. There's no threat. You can breathe calmly. You can breathe deeply. And then you're getting that touch and you get the oxytocin release, which, again, like I said, it breaks that cycle. Mm-hmm. When you have more oxytocin in your system, cortisol levels start to drop. Serotonin levels start to go up. Adrenaline starts to go down. Digestion improves. Because digestion improves, more nutrient uptake happens. More nutrients means your body says, we're fine. We're happy, we're healthy, we're thriving. And we can get to that point with touch therapy, with massage. Some of the other things, you talked about, sleep pattern and how, when you wake up 100 times in a given night, you do these micro adjustments of your posture, micro adjustments of the muscles around your airway to help you breathe better, help you sleep better. And many times people don't wake up. They just barely come out of REM sleep, just enough to turn, right. Just enough to do that. Again, let's say that you're a back sleeper. Here's Shelly. My hand is a pillow. If Shelly's head, part of her neck, part of her upper shoulders is resting on that pillow, and then throughout the night she all of a sudden can't breathe and has to micro adjust to breathe, say she turns her head just a little bit. And turning her head just a little bit, these bony attachments, muscle attachments on the back of the skull are now under a different type of compression. They're actually under compression, and the muscles here have been lengthened in that posture. Now on the other side, where they haven't been lengthened, they've been shortened and they're held in that posture. Now, let's say that, again, you wake up 5, 6, 7 times an hour. That'd be actually kind of a small amount for a lot of people with sleep disorders.
Right.
If you're rocking back and forth, you're keeping those muscles under different strain, different tension all the time. And that's just the muscles that attach to the back of the head where the pillow sits. All the other muscles that keep the head and neck aligned, the muscles that keep the jaw in place so that it doesn't fall open, stay clenched, whatever, those are also there. That's just if you're a back sleeper. Let's say you're a side sleeper and you've got that compression on the side of your body, on the side of your neck, side of your shoulder. And you do actually have to wake up just a little bit more to roll over to the other side or to roll to your back. You've now engaged all sorts of different musculature and put compression on different muscle attachments. And all of those are going to cause tension spots. They're all going to cause more stress spots, more things that you now have to compensate for in your waking life so that you're not holding all that tension, because otherwise you're stuck with that tension throughout the day. And again, the numbers of people that I see that come in that have upper back pain, neck pain, headaches, and I'm able to, work through the musculature in the back of their neck and ask the simple question, how's your sleep? How did you sleep last night? Oh, I didn't really sleep that well. I feel really fatigued. I can feel that in the musculature. I can feel the tension. And the same group of people that were able to get that muscle tension to relax through massage therapy, through stretching, through things like that, helping them to also breathe deeply during the massage therapy. If it corrects that sleep pattern, corrects that tension, and then they start sleeping better, it cascades to better sleep, less tension, less headaches. It all, again, it's that a positive feedback loop.
Right.
The more you do for it, the more it's able to do for itself. And again, as a massage therapist, I'm not out there trying to fix things. My job as a massage therapist is to facilitate the body's natural ability to heal itself, because it can heal itself and correct itself. But the body's exceptionally good at doing exactly what we ask it to do. We're just not exceptionally good at asking it to do what we want it to do.
Kind of bring this all together and talking a little bit more about this. Again, it's about total wellness. I mean, everything that you do, you've talked about the nerves, you've talked about the airway breathing, you've talked about how the reduction in stress and all that musculature in the neck and the shoulders, and I mean, even in the back and the lower back and the upper back. I mean, we all get all of that from everything that we do all day long and the way that we hold ourselves and the way that we breathe. So it is about total wellness. And so when your body relaxes, your breathing improves. And when your breathing improves, your sleep improves. And when your sleep improves, everything improves. Recovery, your energy, your mood, your ability to handle stress, and all those things all improve with just better sleep, with better breathing, with better, when your body relaxes. And that's where massage therapy comes in. You need that relaxation. We get so uptight. I mean, Tyler comes out and does a massage for me on like once a month or every 6 weeks or something like that. I don't know exactly the interval, but it's almost like I need to see him weekly because I build up so much by the time that 6 weeks comes along that he's in there just working and working. I feel really bad because he comes out with a sweat because he's all done, he's just working so hard at working all those muscles. But it really does help because it helps me sleep and it breaks up all that tension and gets me back into this better state of relaxation and healing. As we do this and as we teach these podcasts, people become more aware of what goes on with their body. And a lot of patients don't even realize how tight they are until they finally get that release, and done. And so once that happens, other treatments become more effective. Our treatment in TMJ therapy becomes more effective because now they're relaxed and they can focus, and the body can focus on healing those things that need to heal. Airway focused care, myofunctional exercises. Myofunctional exercises are so important. We teach that so much, and it's becoming more known in the Western states. It's very popular back in the Eastern states, myofunctional therapy, about breathing and helping children breathe and grow right in the facial development, but also in adults, because breathing plays such an important role in the body's function and that relaxation. Because once we get you into that state, we need to have you breathing properly. We need to have you, functioning properly in that way. So myofunctional therapy is such an important role for airway breathing. And airway breathing is so important for our jaw joint and for our total wellness. So massage helps create that environment where those treatments can actually work. Right. And that's that basis. So how do we break the cycle? Because at this point, you can probably see it's a cycle. We've been talking about this cycle of tension stuff. And so tension leads to poor sleep. Poor sleep increases stress, and stress increases tension. And around it goes over and over and over and over. So breaking that cycle takes a combination approach. like Tyler was saying, you have to support the airway, you have to improve the breathing, you have to reduce that muscle tension and restore proper function. And reducing that muscle tension is so key. We a lot of times will be in treating our TMJ and we'll hit a plateau in the healing process and realizing that they've never had a massage and they need to get in and have a massage to take us past that plateau to finally finalize all of their healing process and get their body to kick in and get that healing better. Because as we change breathing patterns and jaw joint, by decompressing the jaw joint, musculature changes. You talked about the insertion and stuff about the muscles and how they shorten and lengthen. And when we do that decompression therapy, we're actually realigning those muscles that have been so tight up in certain areas, and we're teaching exercises to do what's called range of motion exercises to strengthen and also to stretch those out to get them back into a nice, uniform pattern. But so it's just it's nice to have you step in when we get to the point, because we've caused all these muscles now as they're standing up straight because they're breathing through their nose to just be a little bit tense in different areas. Now we've changed things a little bit and we need to massage that all out and get that all broken up. We're really appreciative that Tyler was able to come and talk to us about this today and talk about how massage therapy plays such an important role in our total wellness. I think it's becoming more common too. I don't know if you're seeing more people are getting massages than they used to get because of the critical role. I think there's more massage therapy places opening up around the state of Utah. And if there's one thing that we can take away from this today is that your jaw pain, your sleep issues, and your stress are not separate problems. They're all interconnected. And it all comes back to breaking up that muscle tension and getting things to function properly. So thanks for coming out with us today and showing us and bringing Shelly with us to demonstrate some things that are going on. And we appreciate you joining us. And if you've liked this podcast, please like it and follow us and share it with your friends. And we appreciate your patronage and joining with us. And we hope to see you next time on TMJ Unlocked.